A renowned Houston surgeon preparing for the most challenging procedure yet. He is helping this woman right here who he believes has the largest breasts in Texas. You're going to hear from both the doctor and the patient this hour. Good Thursday morning. I'm Sally McDonald alongside Melissa Wilson. I mean, that is a big surgery coming up, so we wish them well today.
Oh, we sure do. It's only about an hour out, and it was an honor to be able to talk to this woman and talk about how it's going to change her life to reduce her natural breasts. And so that is a big conversation coming up this morning. A renowned plastic surgeon in Houston is preparing for what could be his most challenging surgery to date. In about an hour, he'll perform a breast reduction on a woman believed to have the biggest breasts in Texas. I spoke with Dr. Franklin Rose and his patient as they were preparing for the surgery.
We have done 4,000 breast reductions over these years in practice. She's in the top 1 or 2 or 3 in terms of volume of tissue, grams of tissue removed. She is an O cup. We're going to remove at least 10 pounds of breast tissue. The average breast reduction might be 350, 400 grams, somewhere in there. But this is going to be probably 10 to 15 times that much tissue. Her breasts are very large. She has back and neck pain. Breasts go down almost to the hips or lower. And she can best tell you the symptoms that she has.
Renee, let's talk about this. First of all, I think you're brave to talk about it because it is something very personal. But can you tell us what made you decide to undergo this surgery and how much it means to you?
Oh, absolutely. I've actually been seeking out this surgery for years. I'm 36 years old. I would say for the past 10 plus years. It's very, just uncomfortable, just having all this weight on your chest, having to be decisive on like what you want to wear, the expensive bras. It's just going to mean so much to be alleviated of the sweats, the breathing, the uncomfortability of the bras. I have to go to a custom shop, so they have to be pretty much fitted tight for my cup size and to be sitting right so I can be proportional with my body. So it's going to just be I'm just going to be so relieved. Like I said, just wanting this for so long. I am just going to be so happy to have that relief, that comfortability, and also to wear clothes that I was never comfortable with wearing or able to wear as well.
Dr. Rose, you talk about this being one of the most challenging surgeries of your career. Is it going to be a big challenge? Is this fairly routine for you because you do the same thing? It's just more tissue? What is the difference between this and a typical one?
Melissa, this is not a particularly challenging case, even though I've done 18,000 cases. None of them are particularly challenging if you select the patient well and do it properly. It's not so much how much you remove in a tissue like this, it's leaving an appropriate amount of tissue behind so that she still has pretty form.
And I guess it'll be time to go shopping. That's a dramatic change, right, Renee?
Absolutely. That's, I'm excited about that. I'm like, I'm going to get this. I'm going to wear this. Oh, and just putting it on and just fitting perfect to my cup size, my new cup size. It's just going to be so exciting. I'm going to be liberated. I'm telling you.
And Dr. Rose, what is her recovery time? When can she head out to those jobs?
She'll surprisingly quick. The breast tissue is not endowed with a lot of sensory nerve pain endings. So she'll be surprised at how painless this operation is. And early next week, she'll be able, maybe 10 days or so, she'll be able to go forward in terms of shopping and whatever she wants, really.
We certainly hope it goes well today. We hope to have Renee and Dr. Franklin on the show next week to update us on the surgery as well as how her recovery is going. A Houston surgeon says the largest breast reduction of his 30-year career was a success. We brought you Renee Lawrence's story last week. She was an O cup, believed to have had the biggest breasts in Texas. She was desperate for help, and we're thrilled she was able to get it. She joins us live post-op. Good morning to you. You got to bring us up to date and let us know how you're feeling.
Good morning. I feel amazing.
That is great to hear. Now, when I got to talk to you before your surgery, you had a huge smile just thinking about it. Now I see a big smile afterwards. How'd your surgery go?
I went pretty good. It was maybe around 3 to 4 hours. My recovery, like as soon as the surgery was over, went home, just been resting. And I don't have like really any side effects, just soreness. And I've just been just relaxing, taking it easy.
Oh, that is great to hear. We're right now taking a look at your before and after. I don't know if you can see it, but I know you remember all too well what it was like. Tell me the difference, what you're feeling the most, because I know this was physically painful for you, for your chest to weigh so much.
Absolutely. I definitely can feel the difference. It's definitely not so much weight in the front. I actually went a little bra shopping, so that was really a great experience because I was able to just fit into bras I was never able to before. But just the feeling, I just feel so so much weight lifted off my chest. I actually feel just like I could sleep pretty good, and I don't feel like the normal sweats or just what I was feeling before. So I really feel amazing. I really do, and I really thank Dr. Rose for doing this transition for me.
What a blessing for you to be able to tell us that and to see how far you've come. Now, I understand you've already been bathing suit shopping as well. Tell me what that was like, and are you feeling more confident about the way you look?
I really am. I was like standing in the mirror, like I was just looking like this really happened. Like, I mean, I just feel so overjoyed. Like I don't know. I just felt like that, like this was never ever going to happen for me. Like I was just like, I'm just gonna have to keep suffering and just going that shopping and looking at suits that I can comfortably just put on, going in the dressing room and just putting them on just made me feel so good. Like it was just an amazing experience to look at, like from where I was to now, and to be able to just put it on and just trying them on, turning around in the mirror. It was amazing.
Well, this is something very private, and I think it's impressive that you're able to talk so openly about it, because I truly feel like you can help a lot of women. We've seen so many women come forward now and say, I was going through something similar as well. I didn't realize I could get help. What are your words of encouragement for others who might be hesitant about undergoing something drastic like surgery?
My words of encouragement would be, to do it. If you feel like you can, just like I was saying, like just do the research. Try to speak with your primary care physician. They usually refer you to a specialist. I would just say, just look into the resources. They are there. It can get covered. You won't have to have a lot of out-of-pocket expenses, and just you will really feel so wonderful, like I do. You'll feel relieved of the symptoms. You'll feel relieved of all of the annoyance and of everything that comes with it, the complications, and you can really benefit from getting this done and just have I would say, a healthier, better life.
That was an important thing that you brought up, that many times the reduction is not considered cosmetic. It is considered medical, and your insurance will pay for it, and that can make a big difference. Renee, thank you for sharing your journey with us. Continued just pure happiness to you after all you've been through.
Thank you so much.
All right, you look absolutely amazing. Congratulations.
Thank you.